and welcome back to IRL Jax, where I share with you my real life as it happens. And today I'm going to give you a quick lesson on PCOS. This is part 1 of 5 of everything you need to know to get started with dealing with and understanding your PCOS. Today's episode is going to be about symptoms and diagnosis. We'll talk about what diet you should be on, your treatment, and getting pregnant with PCOS in later videos. Go ahead and be on the lookout for those. First things first, it's important to remember that PCOS, or polycystic ovarian syndrome, is the most common reproductive and hormonal disorder of women in childbearing years. 1 in 10 women is suspected to have polycystic ovarian syndrome, so you're definitely not alone and this isn't some oddity, which is why I wanted to make this video, because it seems like the information about it is kind of scattered, and I wanted to kind of bring it all together and bring all my research together in one place. First of all, polycystic ovarian syndrome is defined as having numerous cysts, usually 12 to 20 cysts, on your ovaries at one time. Not only is it the number of cysts that define this disorder, but it's also the manner in which they present themselves. They usually present themselves in a string of pearl-like fashion in women with PCOS. So that means you're having numerous cysts that are all roughly the same size, and they outline the edges of your ovary. Normal ovaries will have multiple cysts or follicles, but they'll be in different sizes and not all uniform like you see in polycystic ovarian syndrome. That's the telltale marker of polycystic ovarian syndrome, but there's lots of symptoms that also get added into the mix when you're trying to get a diagnosis. One of the most common is heavy and irregular cycles. You're not bleeding every month, you're not bleeding for 7 days, you're bleeding for longer or shorter, and there's no rhyme or reason to when you get your period. Other unpleasant symptoms of PCOS are hot flashes, unwanted hair growth on your back, stomach, and face, as well as possible insulin resistance. Now, insulin resistance isn't diabetes, but they're closely related because they both deal with insulin. Insulin resistance is when your cells don't respond properly to your insulin that's carrying energy to them. So if you want to think about it, your cell has a door and you want to get energy or glucose through the door. You need insulin, which is the key, to get through the door. When you have insulin resistance, your key doesn't fit the lock anymore and your cells reject the energy. Diabetes is when you just don't have enough keys. With insulin resistance comes a few more symptoms, including fatigue and weight gain and inability to lose weight. Obviously, if your blood sugar or your insulin is not working properly, it's very hard to maintain a steady energy level, and it's also very hard to lose weight appropriately. The old adage of calories in equals calories out doesn't really make sense when your calories can't get to the cells that they're supposed to be supplying. So we'll take a look deeper into your diet and exercise plan with PCOS in another video, but just be aware that if you're struggling to lose weight, even though you're counting your calories and doing your cardio, it might be a signal that something's off with your insulin. Now, even though insulin resistance and diabetes aren't the same thing, it's important to know that insulin resistance does up your chance of developing type 2 diabetes when unmanaged. Eventually, if your body keeps producing insulin, your keys, and your doors or cells keep rejecting them, then your pancreas, which creates your insulin, is going to just stop working, which then leads you to diabetes. You don't have enough keys, and your keys don't fit the lock. It becomes a really big problem when you're trying to fuel your cells. This inability for your insulin, glucose, and cells to interact properly together leads to 50% of women with PCOS being overweight. So it's obviously not a for sure thing, but it is worth noting that that is one of the common traits that doctors are looking for when they're trying to diagnose PCOS. PCOS can also manifest in your skin with acne, oily skin, or dark spots. There are also emotional side effects of PCOS, with depression, binge eating, and mood swings just being added to the wonderful list of things that can be caused by your insulin and cells not interacting properly. It also has a hormonal component added on top of this. Anovulation, or the inability to ovulate, is another symptom of PCOS. In fact, in anovulatory infertility cases, 90% of the time, PCOS is the culprit. If you want to learn more about getting pregnant with PCOS, you can check out a video later in this series, or if you want to hear my personal story, you can check out this 1-year summary that I posted earlier. One final note on the symptoms is that this is not related to endometriosis, which is another cause of infertility and period problems. There's no connection, although you can have both diseases, but it's completely coincidental. What isn't coincidental is that people with PCOS seem to have a lot of instances of IBS, or irritable bowel syndrome. The leading theory is that something to do with the hormonal imbalance irritates your stomach and disrupts that process, but no one really knows why this connection has occurred. It's also worth noting that there is the long-term effect of an increased risk of endometrial cancer with PCOS. Any condition that causes you to not cycle ups your chance of endometrial cancer because your endometrial cells are not meant to stay in the body for as long as they do when you're not cycling. This is a small increase in this chance, but it's worth noting that left untreated, PCOS does have some minor long-term effects. A much larger long-term effect is your increased chance of heart disease and diabetes, so it is really worth talking to your doctor if you're concerned about it. So when you do go talk to your doctor, there's 3 things they're going to be looking for to diagnose you with PCOS. You need to test positive for 2 of these conditions to be diagnosed with PCOS. The first thing they're going to look for is a lack of ovulation over a long period of time. A consistent lack of cycle or lack of ovulation is an indicator of PCOS. It's worth noting that you can cycle without ovulating, and there are certain tests that can be done via ultrasound and blood work to test to see if you're ovulating. The second thing they're going to be looking for is a high level of androgens. This is a type of hormone that can be easily tested with a blood test. The last thing they're going to be looking for is what the disease is named after, and that's polycystic ovaries. So many cysts on your ovaries, usually 10 to 20 cysts per ovary, usually presenting in that string of pearls fashion right around the edge of your ovary. This is done with a transvaginal ultrasound and is a really quick and easy way to check for that telltale sign that you have polycystic ovarian syndrome. Again, your doctor is going to need you to test positive for at least 2 of these symptoms to give you a PCOS diagnosis. They're probably going to want to do some other tests too to rule out some more serious diseases. They're also probably going to take a look at your blood sugars to see if you have insulin resistance. If your blood sugar levels come back consistently high, your doctor may prescribe metformin to help treat this. So this was just a quick summary of the different symptoms and how to get a diagnosis for polycystic ovarian syndrome. Like I said, I'm going to dive deeper into polycystic ovarian syndrome and what you should do about it in different cases in a few upcoming videos. Please subscribe to my channel and like this video if you found it helpful, and make sure to check out some of the other videos on my channel. Until next time, keep on fighting, guys.